The other injuries, of course, are the disc injuries, and there are these small little washers in between each vertebrae. These are the discs in the spine. The discs are between every single vertebrae. All right. So when you got to think of the disc as a squishy thing with a liquid center, and so if you think of that, if you put pressure on one edge, it pushes the liquid center the opposite way, and that's how you herniate a disc. And if the disc goes straight back, it's not going to hit too much. But if it goes to the right or to the left, it's going to hit an exiting nerve. All right, and that'll give you numbness and tingling down that side, and potentially weakness. Depending upon the symptom, it will dictate the care. Sometimes it will be an injection of cortisone in the area. Sometimes it'll be just an oral cortisone. But if they have intractable pain or progressive weakness, that's an indication for potential surgery. But disc injuries can keep somebody out for a long time, depending upon how severe it is or how many levels are involved. It could be career-ending. So it can be a significant problem. That's usually in the lumbar spine. Now you can get the same injury, disc injury, in the cervical spine. Okay, and that's a little bit more of a concern because the whole spinal cord is just coming out of the brain here, and so there are more nerves involved here, all for the lower extremity. So a significant injury or compression to the spinal cord up in here can give symptoms even lower down. So a really bad disc injury in the cervical spine can be more devastating. Okay, it can give you the numbness and tingling in the arms and hands again, but it could also give you what are called myelopathic signs, where it's, the person walks funny, have problems with bowel and bladder. So it's real important to understand that. The other important thing about the cervical spine, especially in football players, is do you have spinal stenosis or narrowing of the spinal canal? And that can be congenital. The oldest Manning son had that, and he had surgery, and it prevented him playing football. So that can be exacerbated by arthritis in the spine or the herniated disc. So you can get that. You can be congenitally narrow and make it more narrow by having arthritis growing into the spinal canal that way, or a disc coming this way into the spinal canal.